Well, I am a continuing ed junkie, and I'm always reading about things. And one day I read this little article about help your patient quit snoring, and I thought, that is the most ridiculous thing I've ever heard of. A dentist helping a patient not to snore. And a couple of weeks later, one of my patients came in and I said, well, is there anything else I can help you with? And he said, yeah, doc, can you help me quit snoring? And I said, well, I just read about this. Let's try it. So we tried it on him. And a couple of weeks later, after I'd put it in, he called back and he said, doc, you're a miracle worker. You hear me, a miracle worker. So I thought, this is interesting. Well, he started referring aunts, uncles, cousins, brothers to me. And all of a sudden, I'm making these appliances for what I thought was just snoring. And then there was this one patient who I sent the information into the lab, and the lab called me back and said, we can't do it. And I said, what do you mean? He goes, oh, there's not enough undercut, which may not mean too much to someone who's not in the dental world, but to me that meant a lot. So I said, gee, I wonder what I do now. And he said, oh, don't worry, just bring the cast to the meeting. And I said, what meeting? And he said, yeah, right, I'll see you at the meeting. And I said, I don't know what you're talking about. And he said, the American Academy of Dental Sleep Medicine. And I said, never heard of it. And there was utter silence on the other end of the phone. And he said, you're making these appliances and you've never heard of that? And I said, no. And so he said, you need to be there. That was, I think, on a Wednesday. I canceled all my patients on Thursday, flew out to Seattle. And for the first time in my life, I heard the word obstructive sleep apnea. I had never heard of that. I just assumed people were snoring. And I'm sitting there, and I'm sure everyone in the room could hear my heart beating because people could die. And once I realized the severity or how important snoring is as an indicator for people who may potentially have obstructive sleep apnea, it completely changed my path. And I did all kinds of study. At that time when I first started doing this, very few people did it. Now in the United States, there are only maybe 270 of us who are board certified and only 30 of us whose offices are site accredited in the United States. So I went through all of this studying because I found out I can really help people. Oftentimes the first line of treatment's an oral appliance, a CPAP, and patients, if they like it and it works great, it's fabulous. If they don't like it, it's not so good for them. So what I do is make this appliance, and it's changed people's lives. It's improved people's marriages. It's a wonderful area to be in, and it's so fun to come to work every day.